Okay, everyone, I think we will get started if everyone's happy with that. I would start off with a welcome and an introduction. My name is Myrddin Gwynedd, otherwise known as the Welshman with the unpronounceable name. I'm a communication specialist with motor neuron disease, New Zealand, and I'll be moderating this session this afternoon. I know that's a very fancy word. Thank you for joining us to learn more about the MND Insight Survey 2025. This survey is led by Dr. Natalie Gauld, who was diagnosed with motor neuron disease in 2022. The survey is led by Natalie and it's supported by Motor Neuron Disease New Zealand as well. And its significance, obviously, is quite huge. It's the most in-depth of its kind in New Zealand, and it aims to identify what's working, what isn't, and where care support and services can improve across the board. And the findings will help shape advocacy, funding, applications, and service improvements for people living with motor neuron disease and their whānau. But that is a very casual summary, and Dr. Natalie will be able to explain in a lot more detail than I can about the significance of this survey. So without further ado, our speakers today are Dr. Natalie Gauld, who I've already referred to. And she's the lead researcher, and she's explaining the purpose and the goals of the MND Insight Survey. There's Mark Leggett, who is the Chief Executive of Motor Neuron Disease New Zealand, and he'll be discussing how the survey will inform advocacy and support services. Tony Foster is the Support Services Manager at Motor Neuron Disease New Zealand, and she'll be sharing why participation is so important from a support perspective. So yes, without further ado, let's get started. Over to you, Natalie.
Kia ora, thank you very much for coming along today to listen to some discussion about the survey and understand what it's all about. First thing is, you do not have to come to the session to do the survey, but this is just some extra information for people who would like it. So it is my pleasure to get to this point of being able to talk about the survey, and you should be able to all see my screen. Okay, why are we doing a survey? Myrddin has already explained a number of the things. When I got MND, I was looking for research around a whole heap of different areas and not really finding much from New Zealand. And we have a lot of gaps in knowledge. I was at a disability support services consultation recently, and they were saying there's not much information around care. Our survey, they're looking forward to seeing our survey to get a better understanding of what's working and what isn't for the MND community. And that's replicated across all sorts of areas. We hear anecdotes of wheelchairs arriving late or not working for somebody, not being quite right and having to get adjustments. And we hear anecdotes of other issues that people have. Anecdotes don't work nearly as well as evidence. So we will have evidence to help with advocacy, to help with policy, to help with everybody's understanding of MND. So we'll be able to use it to help educate healthcare professionals and understand which healthcare professionals perhaps we need to concentrate on first. There's all sorts of areas in which we can use this, and I've just left this blank because the screen could be filled up in so many ways because there's so many needs for this research. It's also an opportunity to collect people's stories. We know you've got stories, they're really important to capture. So this is the most comprehensive MND survey in New Zealand, and it's had input from a huge number of people that has been incredibly valuable. We got funding from the Health Research Council initially, and then MND New Zealand as well has contributed funding, as well as a lot of support for all the work to make it happen. We've had input particularly from a large number of people with MND and their families and whānau. some of that input has been just conversations that I've had early on in my journey and their journey to understand some of the challenges and ensure that we capture those. And then others have been where they've reviewed the survey and had a lot of input, and that's been incredibly valuable. And the families of people with MND have also been very, very helpful in providing information, and also noting how important it is to hear from them as well as the people with MND. We've got a research team and advisors, and that's a large number of people. It includes neurologists and social scientists, wheelchair specialists, and various other academics and people involved in different ways in the health system or research. And we've also been doing a look to find questions that have been used in the MND community elsewhere. And we've had Maori review, scientific review, and ethics review. So we've been incredibly lucky with the huge amount of support that we've had to make this the best survey that we can make it. So there's 3 surveys. The first one is for the person with MND, and this is a really big survey, and so therefore we've broken it into 3 parts. And we want all those 3 parts done within the 4-week period that the survey is open. The second one is a family whānau survey where they've got a person with MND in their lives. And then the third one is for people where there's a bereavement. And that bereavement is in the last 2 years. And the reason why we've got that cut off is because we're looking at what's happening most recently in our healthcare system. We know it went through a huge number of changes with COVID and things like that. So what happened to somebody in getting their wheelchair 6 years ago will be quite different from the environment we're in now. So we're trying to understand what's going on now mostly, or in most recent times. So we've got an online survey, and we really encourage people to do the online one if they can. So that could be done on the computer or the mobile phone. And I've checked its functionality on the mobile phone. I think it will be easier on the computer, but it is doable on the mobile phone as well. Or it's paper-based. So we know that not everybody likes to use that technology. And if you're really uncomfortable about using technology, you can always give it a go. And if you don't like it, then go onto the paper, or you can go straight onto the paper. We want to hear from everybody, not just the ones who like to use the computer. And we have, for people with MND, we've got a third way of doing it, and that is by telephone. And the reason why we've got that for people with MND is to encourage people as much as possible, those people with MND, to do it. And we realise that they can have some difficulties with hands and things like that. We've trialled the online one, and it is possible to do it with eye gaze. And, thanks to Brent, who's helped out with going through part 1 for me. What kind of questions are being asked? It's a real variety, so I've just put them into a word art. And the number one thing to remember here is that if there's any questions you don't want to answer, you don't have to, apart from a small number of required questions at the beginning, which is so that we can match up the 3 parts of the survey. And that is age, gender, and you have got an option of prefer not to say, and your location as well, and your year of diagnosis. So we're getting a whole heap of information across a huge number of areas here, and we're really appreciative for all the help we've had in working out what we need to put on there. Okay, so what do we need to do the survey? You read the participant information sheet. Now, honestly, Ethics Committee requires us to have this enormous participant information sheet. It is really huge, and it might be really frustrating to read through, and by the time you got to the end of it, you feel like you might as well have done the survey. So just bear with us. We want you to do the survey if you can. So please read through. Know that we're not trying to make this horrible for you. It's the Ethics Committee requirement. Skim through. It should make sense. Get to the end. Click on the link. And if you choose to do it, you click on the link, and that means that you're accepting you're going to do it. We have Māori support with Jeanette Tioki, our support advisor, and we also have, as I said, there's 3 options. Right, and the closing date, we want it all done by the 9th of April 2025. It's going to come out next week, and so what we really want people to do is get started on it early so that they have plenty of time, so you can have rests in between and you can come and go from it. And just to be really clear, your information is vitally important. Your information is precious, it's te aonga, and we will treat it with the utmost respect. So it won't be given to, your information will not go as raw information to do with you to anybody other than the research team. They're the only ones who will see the raw data. And so health professionals and the MND support advisors and the other people at MND New Zealand, nobody will actually know what you said. The only people who will know what you said is the research team. And so we look after it very, very carefully. Okay, and then what's the timeline? So we're going to be collecting the data. We're going to be in by the 9th of April. The hard copy information will be entered from, the paper copies. The data will be checked for errors, and then the statistician will analyse it, and then we'll have some thematic analysis, and we'll have reporting. And that reporting is actually going to take quite a long time because there's so much. So we'll be prioritising the information we get out as soon as possible. So those first results are expected to be out by June, and that will be with a great big hurry along from everyone on the team. And just a thank you very much, and awareness that this is all a very big MND New Zealand and the MND community effort. So thank you.
Lovely. Thank you very much, Natalie. That was a very comprehensive breakdown. Appreciate it. Mr. Mark.
Kia ora, good to see you all. And there's 1 or 2 names and faces I recognise in the people attending, so nice to see you. And if I haven't met you yet, it'd be good at some stage to do so, if that makes sense. Nonetheless, here we are to talk about this significant piece of work, and thank you, Natalie, for giving us the intro to that. The key thing for me as CEO of this organisation in terms of what we need to be able to do our job is really to understand our community better and continue to do so. Our challenge when we go into bat in terms of advocacy is around having the right information at the right time so that we can deliver information to policymakers and funders and politicians, etc., in order for them to make informed decisions and us to have the right arguments to make. What's the point of this survey in that sense? It's not just a nice idea. It actually gives us a range of tools to be able to go and say, look, here's what we know. This is not just our imaginings. And one of the things I've learned in senior management and health sector over years is that we need an assumption-free and an anecdote-free environment. We need to have data behind what it is that we have. Anecdotes and stories are really, really valuable. And we will get some of those out of this process, I think, but the data behind it and understanding the reality of the challenges that our community faces is like gold to us in terms of how we understand and then build our advocacy program in order to make things better. We talk about research support as an organisation, and certainly our recent funding effort around Walk to Defeat, which was spectacularly successful, identified the first $100,000 raised as going to support research. And I do know that when we talk about research with our community, there's a very strong assumption around research, around curative research and medications and things like that. We certainly do support those things, and where we can, but clearly we're not one of those multi-billion-dollar companies that can do that. Our research, the stuff that we do, is this kind of thing. It's about quality of life. It's about understanding the day-to-day challenges that our community has in reality, and then being able to structure processes and structure things to respond to that so we can go to those people who need to make adjustments. Right now, we see that the disability support services, as they've transitioned into the Ministry of Social Development, are doing a major consultation with the disability sector to try and understand what it is that they need to do in the future. And there's a a little bit of talk around sustainability, which always to me sounds like a cost management exercise rather than a delivery of best outcomes. We need to engage with that process. We need to engage with it with quality information that they can then understand why our community is different in that space. We know that there are regional differences because we hear stories from our community about what they can and can't get and what they can and cannot do, or how the assessments do and don't work. And we want to be able to address those, but we don't see them with any real clarity. And so Natalie's survey will include a significant amount of output from that will tell us about those regional variations. The health sector and the politicians, for that matter, love to talk about moving away from postcode health services, and we would love to see that happen as well, but that's a large challenge, but we think that with this kind of information we'll be able to move forward and make a difference through our advocacy process. We want to be able to improve our own services, so understanding your needs more directly and more specifically gives us their ability to actually structure our own services in a way that supports you better. That we engage with you better and we are more responsive. And we know, certainly you will have noticed that some of our talk in the last little while has been around making time count. And there are large pieces of this piece of work and the work that we're trying to do to make sure that while we know that's a major issue for people going through referral, assessment, allocation and discharge processes, we want to break that up a little bit and make sure that there's a more seamless service for you via the health and disability sectors. And to do that, this survey will give us what I would loosely term a truckload of information to enable us to package it up and go to the funders and the policymakers and make a good argument. So that's kind of where we're at with that. We want you to participate as much as you possibly can. We want to be able to deliver the outcomes that you want to see. And as Natalie said, it will take some time to get it all together, to do the analytics and to package it. I'm going to lean heavily on Mervyn in terms of the comms that go along with this as well. And certainly the survey itself is the undertaking of the actual process between when it's released next week and April the 9th is only the start of that process, as Natalie said. So there will be a lot of work to follow up. I'm really looking forward to seeing what comes out of this. I'm looking forward to the analytics that we deliver and the information we can deliver back to you, so you can also see things more clearly, and hopefully you can then see the connection between that process and how we advocate better and actually get some results by the end of this calendar year, which is pretty much my goal. I think this is one of those moments where we have an opportunity once every 3 or 4 years to get the attention of the sectors that support our services, support our community. You can't do this every year, and we certainly can't lean on you as a community to do this every year because it's an onerous task, and we acknowledge that. This is a large survey, but I think I'm just trying to reiterate the high value that it has, and that it's not just a nice thing to do. This is a really, really important moment, and we in our organisation, in the MND take that very, very seriously in terms of what it is that we get out of this. And Natalie's quite right, that the information is a taonga, and we want to treat it in the right way. So looking forward to seeing the participation, looking forward to seeing Q&A later in this session if you've got any, and we'll see how we go from there. So thank you, Mervyn, for the moment.
Thank you very much, Mark. Very much appreciate that. Our next speaker is another highly respected and valued member of the Motor Neurone Disease New Zealand team. Her name is Tony Foster, and she is the Support Services Manager, and she will share a little bit about why sharing being a participant is important and how the team can support participants as well. Thank you, Tony.
Kia ora. Thank you, Mervyn. As Mark and Natalie have said, this survey is about giving you the opportunity to let us know what's working well and what's not working well, so that we can look at our own services and how we can change that to improve things, but also at the services that you're receiving from the health professionals, and to work alongside them to try and educate and improve outcomes for our community. So it's an opportunity for you to identify to us really strongly in a formal way what's going well, what's not. I know that you all share that with your individual support advisors, but this makes it a lot more official, and we can use that information to hopefully improve outcomes for people and improve quality of life. As Natalie said, it is quite an extensive survey. So there is support available for you to complete that. Talk to your support advisor about what sort of things you need help with. If you're doing it online, do you know how to use the technology that you've got? Do you need any guidance around that? If you need a paper version, that's fine. That can come via us. Just talk to your support advisor and we can make sure that you get that paper survey out to you. If you are having someone help you complete the survey yourself, you're not able to do it yourself, just make sure that they're recording accurately what you want to say, because it's important that you have the voice. Yeah, and don't be afraid to ask questions. The support advisors have all spoken with Natalie about this. They understand the support, the survey and the questions being asked. So please feel free to reach out if you need any assistance with it. Our preferred option is that you do it online if you can, just because there's less room for error, and we make sure that we get all the information. And it makes it easy for you to skip the questions that might not be relevant or that you don't want to answer. But as I said, there is the paper survey, and that's available on request. It's not automatically sent out, but it is available on request. And for those that can't complete it online or the paper version, then you can, only for the people with MND, there's the option of doing a phone survey. And again, your support advisor is a person to talk to about that, and they'll connect you in with the researcher that will ask you the questions at a time that works for you. So just connect, have a conversation with your support advisor around any of your questions or concerns about the survey, and they will help you. Thank you.
Amazing. Thank you very much, Tony. I think we're going back to Natalie now, who is going to give us a live demonstration of a certain portion of the survey. Natalie.
Kia ora, back to me. So I'm just going to share with you a screen. Just a moment. Okay, so this one is going to give you a little bit of an idea. Can everybody see that okay? It's going to give everybody an idea of how you actually fill it out. So you put into your web browser the URL that's in the participant information sheet. So you have to go through that 6-page participant information sheet. At the bottom, there'll be links, and that will show you part 1, part 2, and part 3 for patients. The one for the family carer with the person where the person with MND is still alive, and the one where it's the person is bereaved. And so if we have a look, this is just an example of some of the questions, and this is diagnosis. And it has, when were you diagnosed with MND, and you click on the one that works. So for me, it's 2022, so I'll click on that. Then it goes on to what month were you diagnosed, if known. If you don't know, leave it blank. So for anything that you've got, if you're not sure, if you're tossing up, like, so for the diagnosis, when you were diagnosed, you think, oh, was it 2021 or was it 2022? Just put in one of them. You don't need to look it up. It's close enough, okay? So then what month were you diagnosed? Well, I was March. But if you don't know it, or you can't remember it, that's fine. Don't fill it in. And when did your first symptoms of MND start? So I can put that in there. And what month did they appear? And I don't know what month one appeared, so I'm going to leave that blank. So at the bottom, you've got a little wee arrow on a blue background, and every time you click on that arrow, it saves what you've done. Okay, so if you actually leave this browser, if you closed it and then you reopened it, so you would, there's your link there at the top. If you put that in again, you would come back to this exact same page, okay? And you come back to the same spot of where you got up to. If something goes wrong and you don't, for some reason, come back, that would be really extraordinary. Like if you changed computers from one to another, then what you do is just put in the first few answers that you have to put in that are mandatory. So that's your age and gender and location and diagnosis date. And then you can just keep going, just use that arrow and just keep going until you get to around the place that you finished up before. But most of the time it should just reopen on exactly the page that you got to. So you've got a box like this what symptoms or event related to MND led you to visit your doctor. So you can put in, you know, muscle cramps, you can type in what you want there. We're not looking for perfect English, just write what you like, and I don't care if you do type, you know, spelling mistakes or anything else. What we're after is you to give the information. So muscle cramps, muscle weakness, all, okay? And how long did it take? Now, where we've got an example here of example 3, 6, or 18 in terms of months, then what we want is you to write a digit, a number like that. We don't want, because the computer is going to check that you've got that correct. So if I wrote in 3, it probably won't let me do it. Yep, it won't. So you've got to put in the number. Okay, right. So then, did you get a diagnosis in the private system? Yep, that's fine. Now, here's a slide bar, and I wanted to show you this as well. How satisfied were you with how quickly you were diagnosed on a scale of 0 to 10, where 0 is completely unsatisfied and 10 was completely satisfied? Slide the pointer along with your mouse, the appropriate number. So I put my mouse over the slider at the bottom, and it gives me a number. You can see the number as I go along. So actually, my diagnosis wasn't too bad, so I'll put in 8. Okay, and then it just keeps going on. And we've got lots of boxes where you can write as much or as little as you want. Please don't exhaust yourself and not want to do it because we're asking for too much information. Write what you can, write what you want to share, and don't feel obliged to write a huge amount for everything. Just the most important things that you feel need to be shared is what we want. But we're just giving you lots, we're giving everybody a lot of opportunity to write the stuff that they want to write. Okay, so I'm going to go, that was part 1, and part 1 goes on for a while. It will take you, you know, sort of half an hour if you're reasonably competent on a computer. It will take you about half an hour to do, and it will take you quite a bit longer if you're eye gaze. So start and stop it as you like, and I'd say just get started on the survey next week if you can when it comes out, and then you'll have plenty of time to do. You have 4 weeks. Right, so I'm going to have a quick show of another question that's interesting. So this is part 2 of the survey, and this is one that's a special validated tool which is used for quality of life. And we've had to put it in, we've had to bring it in exactly as they have it. It's called a Euroqual research one. It's UQ5D. And so it tells you here, we would like to know how good or bad your health is today. You will see a scale numbered from 0 to 100. 100 means the best health you can imagine. 0 means the worst health you can imagine. Use your mouse on the slider point on the scale up or down to choose your best number. Push on next. And here is the slider. So you bring the mouse, the slider is a little bit hard to see, and it's in the middle there. So if I bring it down, it goes down to like 26, you can go right up. So you can then choose the health number that you think. So best health, 100. Well, I've got MND, so my health is not going to be 100, but it's certainly not 0 either. So you can choose what number you like, and I don't want to colour your idea by telling you what I will choose. So I'm just going to put it in the middle there, and you can see that it goes into that black box on the left there, and that number is recorded. So that was just something with a sliding scale. And we've got another one with a sliding scale about your well-being, and that's your psychological well-being, your general mood. And we've got another sliding scale here. So again, actually I'm in a great mood, so I'll put in 82, and then I'll go on. We've got a few questions like this where this one's about mood. Over the last 2 weeks, how often have you been bothered by the following problems? And you choose one box for each line. I have to change that wording there. So the first one is feeling nervous, anxious, or on edge. And you've got not at all, several days, more than half the days, nearly every day. Okay, those are the 4 selections. You've got to choose the one that's closest. If it's only been 1 day over the last 2 weeks, well, that's pretty close to not at all. So you tick that. Okay, so they're not all mutually exclusive, which they don't cover the whole range exactly. if you're not sure, just choose what seems to be the best one for you. Okay, don't put a lot of angst or thought into it. You'll be able to work it out. So those are just to give you a bit of a feel of how to do the online. But anyone who doesn't want to do online, please just do it by paper and just work through it. But don't leave it until the last minute. Get started as soon as you can, because it will take a bit of time to work through. And I have to just really apologise for how large it is. But there was a good reason. All of our consultation showed that MND is just, we know it's really complex. There are lots of healthcare professionals involved. There's a lot of equipment involved. There are lots of changes. There's care. There's all sorts of things. And because it is so complex, the way that we can do the very best service for our community is to ensure that we ask all the questions that we should, and encourage people to please, if you can, please do get involved with this. If you go through and you do the hard copy and you only get part way and you can't finish it because you're just tired and you can't face it, send in what you've got. We've front loaded it so that that very first part is the most important. We want everybody to do all of it if they can, but we know that that's not always practical. So do what you can and put it in. And same with your online survey. If you don't get through the entire thing, that's not the end of the world. Do what you can and we'll be really pleased. So I hope that's really helpful, and I'll pass it back. Thank you.
Wonderful. Thank you very much, Natalie, which segues rather nicely to the next section, which is an opportunity for people to ask questions. So there's two methods. You can either put a question into the chat or raise your hand virtually, and then we can take it from there. Is that a hand I can see over there? No? Well, I will kick things off, Natalie. I've got a question for you. You've mentioned already, obviously, we're now at the culmination point where the survey is about to be disseminated, which is obviously going to be an incredibly rewarding experience for everyone. Can you give us an insight into the process and what it's been like for you to get this across the line, as it were?
So I've published a number of academic papers, and I've done research that has been quite extensive before. And I have to say that I have never had as much consultation as I've done here. And the survey is so much the better for it. Because MND is so complex, having all the support advisors look at it, having so many people in the community look at it and give advice, and being shaped by so many voices, the healthcare professionals and the researchers, that has been very time consuming and very, very valuable. So that's taken a lot of work. Putting in ethics applications is not for the faint-hearted. That takes quite a lot of effort as well. So I did that over Christmas and New Year. And then the other thing that I've had to do is upload it into software. And when you're going through the software, if you feel like the questionnaire feels quite long, multiply it by about 10, and that will be the time that I've spent putting it in, because some of the stuff has been quite complex. That sliding scale that I showed you before with the, out of 0 to 100, where you had to use a slider, I had to bring that in as a validated tool, and it required all sorts of leaping through hoops and challenges trying to wrestle it into the rest of the survey in the right way. So it has been quite an effort, but I'm very, very excited about how we're going to be able to use the information. So it's been all well worth it, and it's my big excitement for 2025.
Amazing. Thank you very much. Has anybody got any questions? No? I will ask another question then. I'm not going to reduce you to a soundbite, but if there's one thing that you would hope that this survey will create or allow, what would that be?
It's evidence.
Yeah. Pure and simple. Yeah.
Definitely a soundbite. I have got another thing that I really want that people will ask, and that is, I've only just been diagnosed. I won't be able to fill in a lot of the survey because I'm not using equipment yet, or I've only just started. Do I still do it? And the answer is absolutely, because your information about diagnosis will be the most recent information we can possibly get. It's incredibly valuable. Some people who have been recently diagnosed will also have some equipment. So for someone who's recently diagnosed, a lot of it won't you'll just answer no, you don't have a power wheelchair, and then you don't get asked any of those other questions in the online platform. The online platform is really clever, and if you don't fulfill certain criteria, it won't ask a whole section of questions. So that's one of the advantages of online. But please, everybody, there's nobody for whom this would not be appropriate who has MND.
Lovely, thank you. And I believe we have a question from the VP of CANS. Fire away.
Yeah, sorry, it's my employer's organisation. I have no idea how to change that into my name, and no one's
okay.
Well, first of all, I'd just like to thank Natalie for all she's doing and for being a great sort of advocate on our behalf, certainly in the media in recent times. So that's brilliant. Forgive me if this is a daft question, but when you get the survey results, what do you intend to do with them? Is this just for your own in-house improve things, or is this for putting pressure on the government for funding, or I'm not sure what? Because as an aside, in terms of you're talking about the support advisors and stuff, the South Island hasn't had one for a long time. You appointed one the tail end of last year, and I haven't met the young lady, Sarah. I've had a couple of emails with her September and October. I know she organised a coffee catch-up, but it was an hour north of Dunedin, so myself and I'm assuming others didn't get to go. So we haven't had, certainly in the South, we haven't had that support advice at all for a long, long time. So very long story short, what do you intend to do, and who are you going to put pressure on? Government funding and stuff like that.
How about I take the first part of what the intention is to do with the results, and then Tony, you can talk about what's going on in the South, and Mark, you can also probably talk about what your thoughts are around advocacy. So great question. It's Paul, isn't it?
Yeah.
Yep, great. So thank you, Paul, for joining us today, and thank you very much for that question. When I applied for the Health Research Council money grant for the research in the first place, I wasn't yet working at MND New Zealand, but I saw that research was needed. I felt that there were lots of gaps in the knowledge, and MND New Zealand was very supportive at that time. Now, it's been even better since, because now that I'm working within MND New Zealand, I've got a lot of information along that way as well, and that makes it all the stronger for how we use the information. We've gone through a process of using ethics because we want to have academic rigor so that our information will look very strong. It will have high credibility. In the past, when I have done research, I did a really big vaccination research project that changed how funding happened to pharmacy for vaccines. I presented it in person to Pharmac and to Ministry of Health, and that research changed things, absolutely changed things, and that's what I'm hoping will happen here. So we've done it to a high standard. We've got this whole research team. Because we've done it through ethics, we will be able to publish individual parts of it, but there will be reporting, and we will be prioritising what is the most important information that needs to come out and how do we use it. And yes, it's going to be used to do advocacy, to do policy. At the Disability Support Services meeting, I was talking about this survey, and they were so keen to see the results and have them presented not just as raw results, but actually with the context behind it of what it actually means. So it's going to open doors for conversations as well as add a lot of weight, a lot of credibility to what we're saying. So I'll pass on to Mark, probably finish off this bit and then go on to Tony about the South Island one. So Mark, yeah, you're meeting with people all the time who are at high levels. How is this research going to help?
Thanks, Natalie. It's really, really important. I can talk to the cows come home, as people might be aware, about certain things, but it's all very well having stories and opinions. When we are getting in front of people who can make policy decisions, if we've got data behind us, we can actually potentially force issues, because it's very, very hard to ignore evidence. I mean, I loved it that, Natalie, you pulled out that keyword evidence. Because this is a formal piece of research and it's going through all those significant processes and stages to get there, and it's been a while to get here, but entirely the right thing to do. It means that we can lean on the quality of the research as opposed to just something that we've thrown together that we might do with our community. And sometimes we do that. We did a short community survey last year with 3 basic questions that was very helpful for us in terms of thinking around what we wanted to do around the mission statement, if you like, for the organisation. But this is at another level. This is at a level that says we're paying attention, we're doing it properly. We've got a high quality principal investigator in Natalie with a good reputation in research. And when we stump up to the people who should be taking notice of this sort of thing, we will know and have the confidence of the data in our back pocket to say, well, this is what it looks like. This is what reality is. And while your policies and processes, etc., around disability services are fine for the generic, perhaps, the generic disability sector, our community is different. And I firmly believe that our community is quite different. And we'll be able to show that and be able to show where the sharp edges are and look to address those things. So I'm very, very keen to see the outcome of this, and as soon as possible. So the more information we get, the better. And the stronger an argument we'll be able to have in terms of advocating for this as a community.
Thanks, Mark. And likewise, that the more evidence we get around what's working well, what's not working well, not just within the health system, but within our own systems, will help us shape the service that we have. We are aware that there was a lot of staff turnover, and that did result in the South Island only having limited access to a support advisor. We've now got back to having 2 regional support advisors, which was a position we were in a few years ago, because we had heard that there was a need for this, and that second position had been created. So it's great to be back to that stage, and I'm hoping that Sarah is catching up with everybody, and she is new in the role, as you said. Also, it gives us, you mentioned that the support group is too far away for you to attend. So it's good to know things like that. The survey will pick up other areas where there might be people would like to have that, but they don't have availability for it. So all that information will be used to help us develop our services as well. And as Natalie and Mark have both said, it gives us the evidence to know that we're working in the right direction, and that we're creating things that are worthwhile for our MND community and meeting their needs.
Thank you. I appreciate all 3 of you. Just for yourself, Tony, in terms of that, at the time I was having the email exchange with Sarah, I told her it was too far away for me to go in the van. It's just too difficult. Yeah. But when Kate was the support advisor several years ago, we used to have one here in Dunedin, and there are a number of people in Dunedin. I know that the MND community in Dunedin itself has grown. So I'm a little disappointed that nothing has happened, it would seem, for the Dunedin-based people. So
it is happening in the background. As I'm, you can probably appreciate, it's quite hard to find somewhere that will suit everybody's needs, and being able to find a venue. And I know that Sarah is working on that. She was lucky to find a venue where she did, and that meets the needs of some people. And she is trying to get a venue that will be so she'll be able to have somewhere in Dunedin as well.
Yeah, I don't want to belabor the point, but there is a venue we used to meet. It's a cafe. It's massive. It's local. She knows about it. I told her at the time. But thank you.
Thank you. I'll follow that up with her.
Thanks, Paul. I'll just jump in as well. I've got to come down to Sarah's area as well and catch up. I live in Christchurch, so it's easier for me to do that as well. I've been to the Auckland support group recently and attended Taranaki last year, so I really want to get to those groups and ensure that, you know, support Sarah and what she needs to do, so as does Tony. So hopefully we'll get that organised and I can catch up with you directly in the not too distant future.
Lovely. Thank you very much, Mark and Tony and Natalie, of course. We have a question that popped up in the chat. We'll read it out. Of the 3 categories, I'm in the bereaved tier. My notes could be helpful to the research. I'm not sure that the questionnaire is geared for my category, but for the MND person. Should I complete the survey as if I am the patient? Question. Natalie.
Right. So thank you, Norm, and thanks so much for joining us today. I really appreciate it. You're absolutely right. We are very, very keen to hear from people who are bereaved as well, because your experience is very important as well, and we want to capture that. And so that's actually slowed down the process of developing the survey, because after we developed this absolutely enormous survey for the patient, we then had to go on to the person, the family member looking after that person, and then we had to go on to the other one where we split out the information for the person who's bereaved. So it's a separate survey catered specifically for somebody who's had someone in their lives who was bereaved in the last 2 years. We haven't gone back further than that. So people from, you know, who have lost somebody 5 years ago, we would love to have got their information as well. We know that they'd have stories that they would like to share, but we had to put a cutoff of where is the information going to be most valuable of what's going on in the health system really currently, and that's so we've put on the cutoff of 2 years. So so hopefully you fit in that category and this will work for you. If not, if you're, you know, if your partner passed before that, then please get in touch with me. My email's on MND New Zealand, and you know, I'd be really happy to have your information anyway. It just won't go into the formal research.
Awesome. Thank you very much, Natalie. Are there any more questions? No, I think that is it. Okay, so I think we will bring the webinar to a close. So I think I would just like to say a huge thank you to everybody who's participated today, to the speakers, Natalie, Mark and Tony, for sharing their wonderful insights, and obviously to all of you for taking the time to join us today. We heartily appreciate it. We really appreciate you being here, and hope that you found this corridor to be useful. So the survey will launch next week, so keep an eye out. We will not be quiet about it. We'll be disseminating messages left, right, and centre to let you know. So keep an eye on the Facebook page, socials, email inbox, and so forth. And obviously there'll be communication coming from your support advisors as well. As I said at the very beginning, there will be a recording available, and the same thing applies in terms of learning the when and the how, etc. Again, I would just like to reiterate our thanks and appreciation and gratitude for you being here today. Your input will really help drive real change for people living with motor neuron disease. Thank you very much. That's me, Mardin. I hope you enjoy the rest of your day. Thank you very much.